During your first trimester, your baby's going to grow 300 times larger, from 2 millimetres long, which is about the size of a poppy seed, to the size of a lemon by 13 weeks. In this video, I'm going to be talking all about your baby's development in the womb during your first trimester, and I'm going to be talking about all of the physical and emotional changes that you may experience as you journey through the early months of your pregnancy. If you're new to my channel, hello and welcome. My name's Anja, I'm a hypnobirthing teacher, and my channel's all about pregnancy, birth and motherhood related topics. If you like this video, I hope that you'll subscribe and click the bell icon so you don't miss my weekly videos. A new one comes out every Tuesday. So you probably won't know that you're pregnant for most of the first month. Most women don't experience any obvious pregnancy signs until the fertilised embryo has implanted in the uterus. When this happens, you'll experience a surge in hormones called progesterone and estrogen. With the surge of hormones, you may experience nausea and vomiting, extreme fatigue, you might feel really emotional, and you may also experience breast tenderness. As for your baby, they won't have any recognisable human features yet. The first thing that will start to develop is your baby's brain, so it's going to be really important for you to take a pregnancy supplement containing folate to help with your baby's brain development. HER9 is by far the most superior pregnancy supplement to take, and I highly recommend it. It comes in capsule form. You just take 2 capsules a day with water, and what I really love about this supplement is that the ingredients are actually absorbed properly, so you know that you're getting all of the goodness from the supplement, and also there are no side effects. To get 35% off your first order of HER9, you can click the link in the video description box below for a discount. During your first trimester, your baby's heart and urinary system, which will eventually determine their gender, will start to develop. Also, towards the end of your first month of pregnancy, your baby's bronchial system and lung lobes will begin to form. Once you begin your second month of pregnancy, you may be wondering when to go to see your doctor or midwife. The answer is as soon as you have a positive pregnancy test. But you probably won't be offered an ultrasound scan until after 5 weeks of pregnancy, because it's only then that the gestational sac can be identified on a scan, and it will look like a small dark circle on the screen. Most women will get their first ultrasound around 12 weeks of pregnancy, but if you go earlier, between 6 and 8 weeks pregnant, your baby's heartbeat will be picked up by the ultrasound monitor. Usually at your first pregnancy appointment, you'll be asked about what you're physically experiencing, if you've experienced any bleeding, any pain, cramping or discharge. A little bit of spotting in your underwear and some cramping is very normal in your first trimester of pregnancy, and it's usually linked to your baby implanting in your womb ready to grow. However, if you experience any heavy bleeding or intense abdominal discomfort, contact your care provider straight away. If your care provider is doing a thorough job, they should run through how to eat healthily in pregnancy, what exercise to do, and how to generally take good care of yourself. Just remember that in pregnancy you don't need to be eating for 2 because you'll gain an excessive amount of weight. In your first trimester, your body really only needs an extra 200 calories per day, which is the equivalent of 1 banana. During your first pregnancy appointment, you can also expect your care provider to check your blood pressure and your current weight. They may also feel for your fundus, which is the top of your womb, and that will be felt very low down in your abdominal area. You can also expect to be checked for anemia, your blood type, and in some cases you may also be checked for sexually transmitted diseases. They may also discuss tests for chromosomal abnormalities for conditions like Down syndrome. Just to let you know that prenatal testing is all routine. It doesn't mean that your doctor or midwife think that you have any infections or that anything's wrong with your baby. They just want to err on the side of caution and make sure that you and your baby are kept healthy and safe. By the end of your second month of pregnancy, your baby will now be classified as a fetus rather than an embryo. Your baby's brain will be developing rapidly, their eyelids will be starting to form, and their ears and eyes will be starting to develop. Some of your baby's vital organs, like the liver, pancreas and stomach, will start to develop, and also your baby's hands and feet will start to form, but their fingers and toes will still be webbed. It's during your second month of pregnancy that morning sickness will develop if you're going to get it, and this is largely due to the pregnancy hormones, progesterone, estrogen and HCG, which is made up from cells that form your baby's placenta. A little bit of morning sickness once or twice a day is common. However, from my experience, morning sickness can actually be quite a confusing term, and it can actually happen at any time of day. Most women deal with morning sickness well, but if you find that you're vomiting a lot and you can't keep any food or drink down at all, you may have a severe form of morning sickness called hyperemesis gravidarum, and that can be really debilitating. If this is the case, your care provider may recommend anti-sickness medication to prevent vomiting and even put you on an IV drip of fluids in the hospital to prevent dehydration. I will create a video all about how to tell the difference between normal morning sickness and hyperemesis gravidarum so that you know what signs to look out for to keep you and your baby healthy and safe. In your first trimester, you can also experience food cravings. This isn't usually something to worry about unless you develop something called pica, and pica is when you crave eating inedible things. When pregnant women have pica, it's common to crave eating soil, mud, clay or wood. If you think you do have pica and you're craving inedible things, it's really important to contact your care provider straight away because it's usually a sign that your body is deficient or severely deficient in some kind of mineral or vitamin, and that will need to be resolved as soon as possible. However, if you're craving certain foods more or have aversions to certain foods during pregnancy, that's completely normal. I personally didn't have any really weird food cravings, but I wanted to drink loads of orange juice and eat lots of salty foods. I did have a few food aversions. I couldn't stand the smell of meat, I couldn't stand the smell of coffee, and I didn't want to eat any chocolate, which is really weird for me because I usually eat chocolate every single day. So let me know in the comments if you've had any weird pregnancy cravings or any food aversions, because I love to read all about it, it fascinates me. Another thing that's really normal to experience in the first trimester is fatigue, and this is because so much is going on in your body and lots of energy is going into growing your baby. To look after yourself, try to go to bed earlier so you get more sleep overnight, and if you have the opportunity to nap during the day, do it. So moving on to your third month of pregnancy now. In your third month, your baby bump will probably start to appear and be more noticeable, and clothing will feel tighter than it did before. So to help with this and to ensure that you feel more comfortable, wearing loose clothing is a good idea. If you've been classified as a high-risk pregnancy due to pregnancy health concerns or previous baby loss, you may be seen more regularly by your care provider in your third month of pregnancy, just to ensure that you and your baby are kept safe and well. In your third month of pregnancy, your baby will be about 6 to 7 centimetres long and weigh about 28 grams, so still small but growing rapidly. Your baby's fingers and toes will no longer be webbed, and they'll be developing their skin and facial features such as their lips and nose. Their ears will also be visible. You won't be able to feel your baby moving around just yet, but they will be moving around a lot inside your womb as their leg muscles and arm muscles develop more and more. You may also begin to develop other first trimester signs like more frequent urination, constipation, headaches and breast sensitivity. It's a good idea to focus on drinking plenty of water to relieve constipation and headaches, even though it can be frustrating needing to pee more often. Because your womb is growing, that can put pressure on your bladder and increase the frequency of needing to go to the toilet. But please make sure that you do drink plenty and that you don't not drink just because you don't want to go to the toilet more often. It's really important to stay hydrated because in pregnancy you can run the risk of developing urinary tract infections if you are dehydrated. Your first trimester of pregnancy can be a really exciting time, but it can also cause feelings of anxiety and worry. There are so many physical changes happening, and it's very normal to feel a sense of apprehension, especially if this is your first pregnancy or you've experienced baby loss prior to this pregnancy. Just make sure that you take good care of yourself. Prioritise sleep, stay hydrated, take your pregnancy supplement every day, and try to set aside a bit of time each day to relax and do a meditation to connect with your growing baby. I've created a series of meditations and affirmation tracks for your first trimester so that you feel calm, relaxed and confident as you journey through the early months of your pregnancy. I'll list all of the meditations and affirmations tracks in the video description box below, so please check them out after watching this video. So I hope this video has given you a better understanding of what to expect in your first trimester of pregnancy and what's happening inside your womb with regard to your baby's development. If you have any questions at all, let me know by leaving me a comment below and I'll reply as soon as I possibly can. If you find that the early weeks of your pregnancy are quite challenging, don't worry, because by the time you reach your second trimester, things should feel better and you should feel more energised and radiant. Thanks so much for watching this video today, and don't forget to check out the links to my first trimester meditations and affirmations tracks created for you. See you again soon.